everyone, this is Suprava. Welcome back to another session with me. In today's session, we will be discussing about Epispadias. Now, first, let us understand the meaning of Epispadias. So, if we see if we divide the word that is Epispadias, so we get two words that is epi and pedias, right? So, the term epi means above and pedias means opening. So that means there is an opening which is located somewhere above, right? So that's what we can understand from this word. Now this epispadias is a rare type of malformation of the penis in which the urethra ends in an opening on the upper aspect of the penis. Now it can also develop in females, but it is very rare. So it's most common in males. Now, as normally what we know is that the urethra would end in opening in the tip of the penis, right? But here, what is happening? It is somewhere above, right? It is in the upper aspect of the penis, and that is why the name is Epispadias. And that's what I told you in the meaning, that the opening is somewhere in above. Now let us see what is the definition of Epispadias. So it is a rare congenital condition in which the urethral meatus opens dorsally on the top of the penis, proximal to the glans. So here we have a picture, and that you can see that the urethral opening is at the upper part or upper aspect of the penis. Well, what might be the etiologies of Epispadias? So first thing is, it is unknown. In most of the cases, the etiology of Epispadias is unknown. However, there are several factors which are considered as the etiologies of Epispadias. So if there is any other genitourinary problems, due to that there might be Epispadias. And then if there is inguinal hernia or improper development of the pubic bone, or in case of any other birth defect, this Epispadias can be present. Well, there are different types of Epispadias. The first one is glandular Epispadias. This is the most common type where the urethral opening is present on the top of the glans, or we can say head of the penis. The second one is penile Epispadias. Now in penile Epispadias, what we can say is that the meatus would be present on the penile shaft. And the third one is spinopubic Epispadias. So here the opening would be, or the meatus would be present near the pubic bone. Now moving on to the clinical manifestations. So in clinical manifestations, what we can see is there would be backward flow of urine to the kidney, and along with that we can also see that the penis would be short and it would be widened with an abnormal curvature. And then there can be urinary tract infection and also widened pubic bone. Now, what are the clinical manifestations that can be seen in female child? So in a girl child, what we can see, again, there would be backward flow of urine to the kidney. Then there will be widened pubic bone. Also, there will be abnormal clitoris and labia. Urinary incontinence can be there, and urinary tract infections. Now moving on to the diagnostic measures. So in diagnostic measures, the first thing, we would definitely collect history, and then we would do physical examination. After physical examination, blood test can be done to check the electrolyte levels. Then intravenous speleogram can be done, and also pelvic x-ray can be done, and along with these things there can be also ultrasound of urogenitary system. And apart from these things, MRI and CT scan can be performed depending on the condition. So if it is not a mild case, in that case it needs surgical intervention. Now what will be the goal of our surgical intervention? So the first thing would be the size, appearance and function of the penis. Then if the bladder is affected, in that case we have to establish a good urine control. And then the third thing would be fertility. So majorly there are two surgical interventions. The first one is modified Cantwell-Ransley technique. And through this, the surgeon will rebuild the penis. And there is one more technique which is called as Mitchell technique, and this completely reconstruct the. It is a process of complete reconstruction of the penis. Now moving on to the nursing management. So in nursing management, first we will see what are the nursing diagnoses that will be there for a child with Epispadias. So first thing, there would be pain. There would be also risk for infection related to the surgical incision. There will be impaired urinary elimination and risk for fluid volume deficit. And along with these things, there would be also body image disturbance related to the appearance of genitalia. Now, what are the nursing interventions? So, in nursing intervention, you have to definitely relieve the patient from pain. You have to improve the urinary elimination. And the child will be anxious, so you have to lessen their anxiety, and also you have to prevent infection in these children. Well, so let us conclude our today's topic. So today we discussed about epispadias, which means the urethral opening would be present on the upper aspect of the penis. So we discussed about what are the problems that's going to happen due to this condition and how to manage this condition. So I hope you have got a better insight about the topic. Thank you.